Good morning, everyone, and welcome to the Oakland Chamber of Commerce's Public Policy Committee meeting that is chaired by our very own Crystal. Thank you for sharing your morning, a piece of your morning with us. Also to our chairman who's on the call, Steve Camp, and everything that he does for the organization. With that, I'm going to turn things over to our committee chair, Crystal.
Thank you so much, Keandra, and thank you all. Welcome to our June meeting for our Public Policy Committee. This is our new normal, is meeting virtually, and we're excited to have the opportunity to talk about some topics with our community members that really affect our chamber and also our community in general. And today we have the honor of having one of our commissioners, Dr. Elba Garcia, with us this morning. She will be giving us a state of the county. And then right after her presentation, we'll take some Q&A, and then we will also be talking a little bit about the committee itself, and a little bit about what's coming next in the next few months as we prepare for the legislative session, as it will be coming here as faster than we know it. So with that, I will introduce Dr. Elba Garcia. She has been a dedicated servant to our community and began her service in 2001 when she was elected to Dallas City Council to present District 1, and she was then elected as Dallas County Commissioner for District 4 in 2010, becoming the first Latina to serve in the Dallas Commissioner's Court. So thank you so much, Dr. Garcia, for being with us this morning. I know you have a short window because you're also a dentist by trade, so you're having to go back into the office, but just thank you so much for being with us. And with that, I will share my screen for the presentation, and we will get started.
Good morning, everyone. Buenos dias. Thank you, Honorable Retana, for the invitation, Ms. Gulli, and of course, my good neighbor, Steve Camp. Thank you so much for allowing me to share this morning with all of you and the state of Dallas County. Well, like you say, Crystal, we are in the new normal, and things are changing rapidly since the county start opening for businesses. As you can see in our first slide, as of June 17th, which is yesterday, the total number of confirmed cases of COVID-19 is at the highest, an increase of 413 yesterday. We have now 15,256 cases. Now, a lot of people have called my office and asked me, in the next slide, you can see some of the zip codes. And obviously 75211 is one of the zip codes that has been, as you can see, has one of the highest number of cases. The other two zip codes, one is in Irving, and they're coming from a meat packing plant. So we can see that there's a focus. However, one of the things that we're starting to see in some Latino areas is the community spread. And that's what we see. In Pleasant Grove, we have 2 nursing homes that you probably have heard in the news that have a big focus. Obviously in downtown, we have the jail where we have around 340 cases. But in Oak Cliff, in 75211, we started to see the spread. One of the questions that I asked Dr. Juan, our Dallas County Health and Human Services Director, is why is this? Well, you know that COVID-19 is affecting essential workers the most, primarily people that are in grocery business, in meat packing, in other kind of jobs where you are in constant contact with people. And 75211 is one of those Latino areas where most of the workers are essential workers. So that's starting to happen. And while we expected some of these numbers to go up because increased testing and increased tracking, the reality is that we have been surprised for how fast this virus have spread in many zip codes within Dallas and Dallas County. I just want to remind you that now at the beginning, when we started this crisis, we have just a few areas or places to be tested, and we have strict guidelines for people to go ahead and get tested. Now those guidelines have expanded. if you are a person over 65, if you are in contact with someone that has been tested positive, even if you don't have fever, or if you do not have all these respiratory symptoms, you can go and get tested. The county still has the two sites that we started with, which is American Airlines and Ellis Davis Field House, and there is absolutely no cost. Now, there's also now some private labs and other entities and pharmacies that are doing it for a low cost or free. So I encourage everybody that if you feel that you might be positive, just knowing that this virus, you can feel perfectly well and have no signs and symptoms, to go ahead and get tested. So in the next slide, we can see some of the cities. I know that not everybody lives in Oak Cliff. What are the numbers and patient count and the percentages, with Dallas, as you all can see, being the highest area affected, a big city and high density, and Irving being, number 2 in this graph. So moving along, what is the county doing? Okay, we know that this virus is taking us all by storm. We know that we can get tested. We know that community spread is starting to happen. How do we know when we can go ahead and feel a little bit more comfortable out there? Well, Dallas County, with the leadership of Dr. Huang and Dallas County Health and Human Services Department, created this graph that it's a model that is a guide to follow. And what we want people to know is that if you don't have to be outside, if you don't have to be in the grocery store, if you can avoid being in contact with people, we're still in the red zone, which is stay home, stay safe. The idea of the county, and is not only that Dallas County is following this guideline, it comes from other cities, a combination of guidelines. We were hoping that we could open at a lower pace businesses in Dallas County, because the main issue of mitigation is to be sure that the spread of this virus is slow as we can make it. Why? Because the last thing that we want is that a lot of people get sick at the same time. We want to avoid our health services, especially beds for hospitalizations, to be overcrowded, and see what happened in other cities. So the main issue was to wait for 2 weeks where the hospitalizations and ICU usage either stay level or decrease for 2 weeks or 15 days. That hasn't happened. Pretty much the governor has opened all businesses. We're already in phase 3 for most of them. So we want people to remember that we are not out of the woods, that we still have to be sure that we have capacity. 2 weeks ago, we were at a 60% capacity of beds and ICU. Today, we are over 70%. So that is starting to climb. And I just want to remind all our members of the chamber that I know that a lot of you are business owners, to go ahead and take precautions with your employees, always protect them. I think the guidelines are already there, pretty much established. We now are talking in Dallas County about passing an ordinance probably tomorrow or Monday about wearing masks, and be on the businesses to enforce, not so much on the citizens. Obviously, there will be penalties. And it just came to me last night that we've been on this before many years ago with the Lock, Take, and Hide campaign. But definitely one of the things that I will say at our meeting is that while I believe most of us as business owners will be more than happy to help in this crisis, we want to be sure that it's something that does not penalize heavily the business owners, because right now it has a penalty of $1,000 for a business that does not comply. So I would love to hear your input and your comments. As you will see later, my email address, or a lot of you have my cell number, so don't hesitate to call and tell me how you feel. So moving along, we still have in this guide of COVID-19 risk, we're still on the red. We hope that we can move once at least in the next month and a half into an orange. And all these guidelines, you can check out them, dallascounty.org and Dallas County Health and Human Services Department for more information and to read every single part of it. So knowing all that, we know that the economy has suffered. We know that a lot of businesses, 1 in 5 restaurants probably will not make it back. We know people are hurting. So what is Dallas County doing? Well, as a result of the CARES Act, funding that it was sent to municipalities and county, Dallas County received a total of under $243 million and gave most of their money based on a formula put by the governor on a $55 per individual that is living in that municipality. We already dispersed around $75 million. And we have created some programs knowing that the need is out there for funds to restart some of your businesses, to pay your employees, to pay some of your utilities, that in conjunction with all these municipalities. And people say, why Dallas, the city of Dallas, is not included in any of these emergency business assistance programs? And the answer is simple. Big cities receive funds directly from the federal government. The city of Dallas received $266 million, and while all the other entities, small municipalities in Dallas County, didn't receive any. So we felt strongly that we wanted to share all this money with all the 26 municipalities left in Dallas County. So that's why in the emergency business assistance programs that I am going to speak in a minute, Dallas, the citizens of Dallas and businesses located in the city of Dallas are not included. So the first program that we are allocating $5 million is the Emergency Business Assistance Program. This program will target small businesses with less than 100 employees. It will provide a maximum of $15,000 forgivable loan per businesses. We just started this Monday, June 15, and the application period will go till June 21st of this year. And you can see the website right there on the screen. It's going to be managed by a company, NDC, which is the one that also managed the city of Dallas, ndconline.org. You have to be a business that is located in Dallas County, like I mentioned, excluding the city of Dallas. You have to have been in business since February 1st of 2019. Must have an annual gross revenue of less than $1.5 million, and you have to experience at least a 25% loss of income as of March 1st of 2020. You can see the email out there for any questions, as well as the phone, if you are interested in applying to this program. In the next slide, you also see, I do want to say that not everybody in this program, the Small Business Assistance Program, is eligible. Obviously, if you're an employee of Dallas County, a board or commission member, a person that have business with Dallas County, or a lawsuit against Dallas County, and you have to be current on your state and local taxes. So the loan is a forgivable loan, but you have to stay in business for 4 months and retain 90% of your employees, full-time employees, as to March 1st. So one of the things that I do need to mention about this program is that 20% is going to be allocated into the small businesses in the southern sector, which I think is a very good way of doing this. And with less than 50 employees. As we've seen, some of these loans have been, have been making a difference, but also have been going to a lot of the big businesses. We created these programs with small businesses in mind. So moving along, I also wanted to say that we have a housing assistance program. This is in part, we have different partnerships, but one of them that has been extremely helpful is with Jewish Family Service. Why? Because anyone can apply. And while some is exactly the same program that provides 3 months of housing assistance per household, a maximum of $1,500 per month, it doesn't have any requirements for legal status or citizenship. So anyone that has need right now, and we know that a lot of the essential workers, legal status is an issue, and they've been there in the front lines with everybody during this pandemic. So we wanted to be sure that everybody has an opportunity to get help. So that is with Family Service of Greater Dallas, Jewish Family Service of Greater Dallas. You can see the email on the screen, their phone number, and all this is providing information in English and in Spanish. Moving along, the next slide, we're going to see Catholic Charities, a great partner with Dallas County. Pretty much all the requirements are the same for all these programs. However, in a letter from an employer stating that the reduction of hours or loss of a job, even if you don't have that letter, if you have your pay stubs or a medical letter showing your inability to work during COVID-19, and of course, single parents households, the only thing they need, if sometimes they're single mothers that have no work, is a proof of school of childcare closure. So there is the phone and the email as well, and Catholic Charities also has very little requirements for any kind of legal status. And moving along, in the next program, North Texas Behavioral Health Authority also just launched a program for tenant assistance. I have to say, a lot of people have called me and say, hey, but it's only for patients that are patients of the North Texas Behavioral Health Authority. Do I have to have any kind of behavioral issue or health history? The answer is no. You can apply to this program if you are a resident not only of Dallas County, but Ellis, Kaufman, Rockwell, and Navarro County. And you can see their applications. Obviously, all these programs, you have to fill an application and it has to be completed. Otherwise, it's not considered. You can always call as well, and you can see the number in the screen. And in the next slide, we also see that while we're talking about all these programs, guys, and our economy and how we're going to beat COVID-19, we also have to be very aware that there's an opportunity to get funds in the future is by the census. I know that we have not been focusing on this issue. COVID-19 is in our minds, but the deadline for filling out your census application have been extended to October 31st. And it's easy. For the first time, you can fill your census application by phone, by your iPad computer, or your mobile phone. So you can do it in many languages. It's only 10 questions. There's no wrong answers. How you feel, where your background or ancestry is. So I know that a lot of people say, but I am not in any of those classifications. Put your own. There is not a wrong answer, but fill it out. We have seen an undercount, particularly in Oak Cliff and minority communities, particularly minority communities and Latinos. So it's very important. And I don't know if Honorable Casey Thomas is within our participants today, but I know that his district has been in the forefront. He's doing really good, and we want to be sure that North Oak Cliff is counted too. It costs millions of dollars to every municipality when we have an undercount. So I want to encourage all of you business owners that are joining us today to be sure that all your employees fill out their census forms. And then, of course, I want to be sure that there's help. People call us to the tenant assistance hotline, and there's all kinds of help right now. I want to be sure that you all know that if you have the tenant eviction hotline where we can guide you on what paperwork or how to get into the right program, employers needing essential workers, COVID-19 inquiries. There's so much misinformation out there. We want to be sure you have the right information. We've seen a high increase in domestic violence and obviously behavioral problems. So there is help, there are programs. Most of these programs have continued to provide services. A lot of them are through teleconferencing, which is, like you say, the new normal, but the help is there. And in the next page, you can see some of more additional information. Salvation Army, pantries, food pantries for families that I know they call my office and they don't know where the next meal is going to come from. And it's all over Dallas County in the 27 municipalities. So you can see the Salvation Army, Irving, Grand Prairie, all different municipalities have different programs to help you and your family to get through this pandemic. And in the meantime, I just want to remind all of you that there it is, the Road and Bridge 4 and our district is ready to help. We've been very involved with helping municipalities right now to improve not only services, but information. And I know that Ms. Blanca Torres, Deputy Chief of Staff, is with us. And there it is, our phone number, our email. Please contact us with any questions. We always have a door open policy for everyone. And with that, any questions?
Thank you so much, Commissioner. I really appreciate everything that you're doing for us, and especially now with the numbers of COVID going up and just all of the assistance that you all are giving us. We truly appreciate everything that you're doing and disseminating the information to our constituencies. I did want to have some time for questions, and so I'm trying to open the chat function to see if there are any questions on the chat. We did have a question, Dr. Garcia, will you be sharing the slides? We definitely would love to add some of the services mentioned in our next bulletin. If you're okay with it, was it okay if we share slides with all of the participants? Perfect.
Everything is shareable, and it's also in our website, Dallas County, Elba Garcia, DDS at dallascounty.org as well. So yes, any information. And if you want more detail, if any of our members wants more detail on any program, I'll be more than happy to email it to them or send them any information that they require. I know this is in a big nutshell, but definitely we can send all the information that they need.
Hey, Crystal,
Perfect.
This is Val. I had a question.
Hey, Val, how are you?
I'm good. So, Dr. Garcia, at the city level, when we did the small business, what you guys are doing, and I'm sorry if I missed this in the first part, we got such an overwhelming response that we ended up having to do a lottery for the applicants. Do you see that happening, or are your funds much greater than?
No, Valerie, you're right. It's the same amount, the $5 million. We believe that it's going to go very quick. One difference that we have in our program, and I'm very happy that our staff recommended this, is that 20% of the businesses selected to move on the next funding stage once the application is filled. And I want to emphasize that the application has to be completely filled. 20% of the businesses selected will be in priority strategic areas, and 40% of the businesses selected to move on into the next funding will have to have less than 50 employees.
Okay.
So, I mean, that would allow 20% of these businesses to be probably in the southern sector, or those areas where we can see that not a lot of people have get funding or help, and the other 40% in really small businesses. The city didn't have this classification. We hope that this make a difference. Now, if the federal government does a second round, we're ready to allocate more money to this program. Because the reality is we got less money than the city of Dallas, and we have more municipalities. Remember, Dallas County is $2.6 million. The city, 2.6 million people. The city of Dallas has 1.3 or 4 now. So comparing apples to apples, we need to probably allocate more funding into the municipalities in Dallas County. Now, let me say something else. We already allocated $75 million to different municipalities, and obviously each municipality received this money based on population. Some of these municipalities might be able to do some similar programs into their cities, which obviously that would be totally okay with Dallas County. So there might be more help, Valerie. That's the point that I tried to make.
Thanks, Val. We do have another question. We understand that the federal government is going to stop its part on testing in a couple of weeks. Does the county have plans for ramping up testing once the federal government stops their assistance?
We are looking into different programs. Obviously, we have seen, and we're very happy that the city of Dallas allocated some of their funds to mobile units doing testing, particularly in those areas where people don't have transportation, or really they don't have a car to go into American Airlines or Eli's Davis to go through the testing. So definitely it has been extended, but once it finished, we will look into the possibility of partnering with other entities to continue the testing. I've been very glad to see leadership in the business community with CVS, which are offering some of this testing for free, the City of Dallas, Health and Human Services Department as well. So the answer is yes, and that door is still there. We'll see how the numbers continue to look.
Thank you. And just a reminder, if you have a question, feel free to add it in the chat, or let us know that you have a question. In the meantime, I did want to ask Dr. Garcia, and I know you touched on this earlier in the presentation, and it's related to the confusion around municipalities being able to enforce or require businesses to put on masks. Can you talk a little bit about what's happened in the last few days? I know the judge in San Antonio, Governor Abbott has allowed a judge in San Antonio to enforce this. So can you talk to a little bit about how that's going along and what the county plans to do? You touched on it a little bit earlier, but I know we've been receiving a lot of questions about that even in.
Yes, and I'm very, I wanted to ask our members, how do they feel about this? I'm open always for your input. As you just said, Governor Abbott will give a blessing to Bexar County, and County Judge Wolf already passed an ordinance that allows businesses to enforce the uses of masks. And we know now, what we didn't know 2 months ago, that mask is obviously, while it doesn't prevent you to get the disease, it does protect you and someone else for getting the disease. The governor in the ruling does not allow municipalities to enforce the uses of a mask, but if the businesses can tell you to wear a mask when you are walking into their businesses, and this is, it will be on all of us. Grocery stores, every business will be able to enforce the uses of a mask, or they're the ones that will be punishable with $1,000 fine. And that's something that the governor has said, well, if a business is asked to do it, hey, if they want to do it, they don't feel comfortable, I mean, go ahead. He opened the door for this, but I wish it was voluntary. It will not be. It will be regulated. Now I want your opinion. I know that as a dentist, a lot of people think, oh, well, I'm going to open my mouth. What do I need to walk in with a mask? And my response to all my patients is, when we make the appointment and we confirm the appointment, is, remember, you're going to walk into a waiting room, and while we have the social distancing, you cannot come in without a mask. So I will tell you that I will ask for this. The guidelines have to be, the word is conspicuously placed in the business so everybody can read them. And I will ask that is something that we can put simply in our businesses, not something that we have to spend money in buying or something of that nature. But I am very, we're already doing it in my business, so I believe that it will be good, because I think that you see right now, going into the grocery store, going into any public place where you expect everybody to wear a mask. A lot of people are not. So that is what is probably going to be for a vote either today or Monday with the Dallas County Commission of Court. And I would love to hear your input. As a dentist, I know that people have told me, well, but you wear it all the time, Elba, you wouldn't have any problems enforcing something like this. And I have to tell you, I mean, you'll be amazed how many people do not think that wearing a mask is important, because as we remember, CDC did not implement the use of masks until after March the 4th. Before, it was not considered something that will help or prevent the spread of the virus. And we wanted to keep some of the masks for essential health workers. But now we know that it does help, that it's important, that it makes a difference, that protects you and protects others.
Thank you so much. We look forward to more information coming through. I know that you have to leave us, but we did have a couple of questions. So what I will do is I will send those over to your office, and then if you can respond, and I will be sure to send those over. We did have a question regarding hospitalizations in the surge, and another question regarding economic projections for the county's budget for next year. And so I will be sure to send those over to you, and we can share this as well as the presentation and the answer to those questions to everybody that was on. Everybody signed up. And so again, I just want to thank you for joining us this morning. I know you have to head out, but please, to your point, anybody on the call that has any thoughts around the new potential ordinance changes related to the mask and the requirement, as Dr. Elba Garcia said, please feel free to contact our office. They definitely are very open and responsive. I know, because I contact you quite frequently. So thank you so much.
Thank you to all of you. Thank you to the Oakland Chamber for always being in the forefront of the issues that affect not only Oak Cliff, but businesses all over Dallas County. And yes, we have to be sure that we keep the hospitalizations to the minimal, and sadly that is not happening. Just to address the last question, and yes, Dallas County budget is going to look really lean, especially because, as you all probably know, most of our values, our budget is based on property values, and these values, I'm pretty sure we're going to see a lot of protest, because all our properties were evaluated before COVID-19 by January 1st. So we expect that to happen, and I don't blame anyone. This is the year where probably you have a good chance to your protest go through. And definitely it's going to be a lot of very hard choices. But again, we're all in this together. Please, all of you, remember, it's about social distancing. It's about staying home if you don't have to be out. And of course, wear a mask, stay safe. And thank you all again. Honorable Retana, as always, a pleasure to be with you too.
Thank you, likewise. Thank you, Dr. Garcia. Have a great rest of your day.
Bye.
Thank you. Well, as we continue the conversation, as many of y'all know, we at the Oakland Chamber, we definitely want to make sure that as it relates to both local policy, regional policy, state and policy as well, really getting to meet with our businesses, meet with our leaders, and really try and figure out what are the needs of our community and try to advocate for those both on a local, state, and national level. And with that, as you know, many of you all know that the legislative session is going to be coming up next year. It's going to be here before we know it. I know many of us here on the call, like Valerie Hawthorne and Isaac Foz, work on public policy on a daily basis. And so we really want to make sure to hear from you all. This year, as chair of the Public Policy Committee, really want to bring in more members, committee members, and that will be able to help us shape our legislative agenda as it affects our Oak Cliff community and some of the businesses that, organizations and businesses that do business here in the area. And so we'll be talking about education, about health, transportation issues here in the next few months. Our next meeting is going to be in June, and we're hoping to get our state representative in to talk to us about what they foresee the legislative session looking like. What are some of the issues? Obviously, we know healthcare was going to be a huge issue, and I believe it still is. But with COVID and the budget, I think it's definitely going to change some things that were projected here in the next legislative session. And so, especially with the budget, and then also the census, we're hoping to talk about redistricting. That's probably going to be pushed out. And so anyhow, we meet every other month during the interim as a public policy committee. And so we really welcome all of you. If you signed up today, that means we have your contact information. And so our hope is to be able to, again, get more individuals into the conversation as it relates to public policy, to see what are some of the things that you're seeing, what are some of the struggles, the barriers, and really continue the conversation. And so the next meeting in August, I'm sorry, I misspoke. Our next meeting will be in August, as we meet every other month. That meeting will, like I said, we'll have somebody talk about what's going to happen in the next legislative session, just projections. I know some things will change because of leadership coming into the next year, as we have also the November election that will also may have some changes for us. But in general, really just want to hear from you all. So you'll be receiving information from us as it relates to our next meeting, what those conversations will be, and really would love to get a few of you all here on the call today to really join us in this effort to create our legislative agenda for the chamber. And so with that, as I mentioned earlier, I will also be sending the presentation that Dr. Garcia sent out. Please feel free to share that information with your organizations as well and your businesses. We definitely want to make sure to be sure to use some of those funds that are needed. And just to, also, if you do business in other cities, please watch out for some of those municipalities that are going to be using some of those funds to create their own programs. I'll give you an example. As city council member for Farmers Branch, we are getting $2.2 million, and we are looking at doing similar programs just for our municipality, which is great because businesses and our individuals will be able to, if they don't get the information from the county, they'll be able to apply for funding in their respective municipalities. So if you do business or have organizations that cover not just city of Dallas, but other cities, just be on the lookout for some of those programs as well, and encourage your electeds to also do the same. And with that, I will turn it back over to Ms. Keandra to close us out and give us some announcements on behalf of the chamber.
Thank you so much, Crystal. We really appreciate it. And Dr. Garcia, thank you all for being on the call. We just have one quick announcement. This organization will be hosting a Black Men's Matter conversation on Saturday, the 20th from 1 to 2:30. So if you have any Black men that are interested in having a candid conversation in and around the things that are going on in our society right now, most certainly please invite them to that event. And with that, this meeting is now adjourned. Thank you all.
Thank you all for joining us.
Thank you.